stop. If you have ever started strong, then watched your firmness fade and your confidence drop, this is the 60 seconds that can change the rest of your night. You are not broken, you are not alone, and there are clear reasons this happens that you can fix, starting today. I am Dr. Zara Vale, a board-certified urologist. I help men protect their sexual health with simple, science-based steps. What follows is a direct, practical guide to staying hard from start to finish, built on clinical experience and research from peer-reviewed journals and professional guidelines. Keep listening, because every section ends with a fast fix you can use right away. First, let me clear a common myth. Losing an erection does not mean you are less of a man, and it is not an automatic part of aging. With age, nitric oxide production falls, sensitivity can decline, and blood vessels stiffen. That changes the conditions, not your potential. When you know what is happening and why, you can take back control. Reason 1. Gravity pulling blood away, not in. When you lie flat with your partner on top, gravity encourages blood to leave the penis, and small venous valves may not trap it effectively. The fix is to use gravity as a helper. Choose standing, kneeling, or seated positions facing your partner, so blood pressure favors the erectile chambers. A small change in angle can be a big change in firmness. Reason 2. The stress response switching off arousal pathways. The brain is the most powerful sexual organ. Worry about performance activates the sympathetic nervous system, which is your fight or flight mode. Erections rely on the parasympathetic system, the rest and connect mode. The fix is to interrupt stress quickly. Breathe in for 4 counts, out for 6 counts, 5 cycles. Put your attention on sensation, pace, and connection, not on the outcome. Use short, reassuring words. When pressure drops, blood flow improves. Reason 3. Less nerve sensitivity over time. Nerve endings can be less responsive with age, diabetes, high blood pressure, or repeated mechanical stress. Less sensory feedback means less brain stimulation and weaker erections. The fix is to restore input and support nerves. Walk briskly most days, add short cardio bursts, and prioritize sleep. Ask your clinician to check testosterone, fasting glucose, and blood pressure. Some men benefit from controlled external vibration therapy to reawaken nerve response, used safely and briefly. Think of this as physical therapy for sensation. Reason 4. Low arousal because the mind is not present. Work stress, arguments, or a distracted environment reduces the quality of the arousal signal. The fix is deliberate ramp-up. Extend foreplay for both partners, use slower pacing, warmer touch, and clear consent. When the brain is fully engaged, the body follows. If you notice your mind drifting, pause, reconnect with breath and touch, then continue. Reason 5. The self-fulfilling loop of fear. After one lost erection, fear of losing it again can trigger the same outcome. This loop is common and fixable. The fix is to reset the goal. Replace the thought of staying hard with the goal of giving and receiving pleasure. If firmness drops, change stimulation, change position, or shift to other intimate acts without apology. This flexibility breaks the loop and often restores erection naturally. Reason 6. Vascular health warning signs. Erections require healthy endothelium, the inner lining of blood vessels that releases nitric oxide. High cholesterol, high blood pressure, smoking, and diabetes damage this lining, and the small penile arteries show problems early. Studies show erectile dysfunction can precede cardiovascular disease by several years. The fix is daily vascular care. Move your body, favor fiber-rich foods, reduce ultra-processed meals, hydrate, and discuss lipids, blood pressure, and glucose with your clinician. Nutrients that support nitric oxide, such as citrulline from watermelon or targeted supplements, may help some men, but lifestyle is the foundation. Reason 7. Hormonal changes, especially lower testosterone. Testosterone supports libido, nitric oxide signaling, and tissue elasticity. Levels can decline about 1% per year after 30, faster with poor sleep, excess weight, or high stress. The fix is to measure, not guess. Ask for morning testosterone testing and repeat if needed. Improve sleep. Resistance train 2 to 3 times per week and reach a healthy waist size. Some men benefit from clinically supervised treatment when appropriate. Restoring healthy levels can improve desire, mood, and sensitivity. Reason 8. Alcohol and timing. Alcohol is a central nervous system depressant. Even 2 drinks can reduce firmness. A heavy meal pulls blood to the gut, not the pelvis. The fix is to keep alcohol light or skip it, and allow at least 90 minutes after a large meal before sex. Many men feel a difference the same night. Now combine these into a simple plan. Before sex, empty your bladder to reduce pelvic nerve pressure. Use gravity in your favor by choosing positions that let blood flow into the penis. Build arousal for both of you with steady, responsive touch and clear consent. Keep alcohol low and give your body time after big meals. If you suspect venous leakage, consider a safe, properly sized constriction ring for short periods, following safety guidance. Space out ejaculation if you are over 40, and notice better performance with recovery days. Many men find 5 to 7 days between ejaculations, restore stronger drive and firmness, support circulation every day. Walk, lift, or cycle most days. Eat foods that protect vessels such as vegetables, fruits, legumes, whole grains, fish, nuts, and olive oil. Stay hydrated. Manage blood pressure, lipids, and glucose. Get morning sunlight when possible. And protect sleep because testosterone and nitric oxide pathways are sensitive to sleep loss. If you have numbness, cold feet, chest pain, or new exercise intolerance, talk to your clinician because sexual health is heart health. Support sensitivity. Ask for a testosterone check if your morning energy, drive, and erections have slipped. If you have diabetes or prediabetes, aim for steady glucose control, because nerves and small vessels are vulnerable to swings. If pornography has changed your arousal threshold, consider a reset period to let normal cues feel strong again. If anxiety is a major trigger, brief cognitive strategies and paced breathing can be as important as any device. Let us address the shame that often hides beneath this topic. Needing help is common and human. I have seen men in their 50s, 60s, and 70s regain reliable erections by fixing blood pressure, losing a few inches from the waist, improving sleep, and practicing calmer pacing. When firmness returns, confidence rises, relationships improve, and many health markers improve with them. Sexual function is not separate from your health. It is a mirror of it. Here is your fast checklist. Empty your bladder. Breathe slow to switch on the calm system. Use gravity to help you, not fight you. Build arousal for both of you with patience and presence. Keep alcohol low and leave a window after large meals. Move your body daily and train your muscles a few times a week. Eat for your arteries. Hydrate. Sleep. Check testosterone, lipids, blood pressure, and glucose. Consider safe vibration therapy for sensitivity, and use a ring cautiously if venous leakage is suspected. If something feels off or new chest symptoms appear, seek medical guidance, a final word of science and hope. Erections depend on healthy endothelium releasing nitric oxide, responsive nerves sending clear signals, and smooth muscle relaxing to hold blood. Research shows that when you improve endothelial function, restore hormonal balance, and calm the stress response, erectile performance often improves. The same habits that protect your heart protect your erection. Small changes, repeated, become strength. You are not defined by a single night. You are defined by the steps you take today. Choose one fix to try tonight. Choose one lifestyle upgrade to start this week. Your confidence is worth protecting. Your health is worth building. And your future is not behind you. It is in front of you, and it starts now.